Hello and welcome. We're going to talk about something that affects so many people but is so often misunderstood, and that's endometriosis and the kind of chronic pelvic pain that can come with it. If you're watching this, you're probably looking for answers, and you've come to the right place. We're going to explore what this is and, most importantly, how you can find real, lasting relief.
So, does this sound familiar? You've been told for years that your painful periods are just normal, that you just have bad cramps. You might feel like your pain has been brushed aside, or that nobody really gets how much it's impacting your life every single day.
I want to start with the most important thing I can possibly say to you. What you're experiencing is real. This pain is not in your head. It is not something to just get over, and you are absolutely not alone in feeling this way. Okay, so let's get into it. The first real step toward feeling better is actually understanding what's going on. So what exactly is endometriosis, and what is happening inside your body that's causing all this pain? Well, to put it simply, endometriosis is when tissue that's like the lining of your uterus decides to grow in places it's not supposed to be, like on your ovaries or fallopian tubes, or basically anywhere else in your pelvis. Now, this tissue still acts like it's in the uterus, so it thickens and bleeds every month with your cycle. But here's the problem. It has nowhere to go, and that's what causes all the trouble. The inflammation, the scarring, and of course, that deep, persistent pain. And the symptoms? Well, they can be all over the place, but they go way beyond what you'd call typical period discomfort. We're talking about really severe, can't get out of bed period pain, pain during intercourse, even pain when you go to the bathroom. And on top of that, so many women deal with chronic low back pain, constant fatigue, and bloating. If you're nodding along to any of this, you are definitely in the right place. It's really important to see the difference here. Typical period cramping might be annoying, but it's usually tolerable. It shouldn't be making you cancel plans or miss days of work. Endometriosis pain, though, that's a whole other level. It can be truly debilitating, and often regular over-the-counter pain meds just don't touch it. It's really in a category all its own. And this is so crucial to understand. This quote from the Mayo Clinic says it all. You could have just a tiny bit of endometriosis tissue, but be in a tremendous amount of pain. The severity of your pain does not match up with the stage of the disease. So if anyone has ever told you your case is mild, please know that doesn't make your pain any less real or severe. Okay, so we've talked about the endometriosis tissue itself, but there is another huge piece of this puzzle that honestly gets missed all the time, and that is your pelvic floor. Let's talk about how your body's own defense system can actually end up keeping you in a cycle of pain. Think about it this way. If you sprain your ankle, you automatically start to limp to protect it, right? Your body does the exact same thing with internal pain. To shield itself from that constant inflammation and pain from endometriosis, the muscles deep in your pelvis, your pelvic floor, along with your abs and hips, just start to clench up. It's a totally natural protective response. We call this automatic tensing muscular guarding, but what starts as protection can, over time, become a whole new problem. Those constantly tight muscles get overworked and tired, and they become a source of pain all on their own. This guarding is a huge reason why intercourse can be so painful, why you might have bladder issues, or why you just have this feeling of constant, dull discomfort. And here's the thing that can be so frustrating for so many. This explains why you might still have pain even after a surgery to remove the endometriosis. The surgeon can take out the tissue, but that doesn't magically erase the years of muscle guarding and nerve sensitivity that have built up. That pain pattern is still it's stuck in your muscles. Now, I know that might sound a little bleak, but here is the really good news. There is an incredibly effective way to deal with this muscular side of your pain. So let's talk about the path forward and how pelvic floor physiotherapy can make a world of difference. This right here is such a hopeful, powerful statement. Pelvic floor physiotherapy is so effective because it doesn't just look at the disease, it treats your body's response to the disease. It's all about addressing those muscle and nerve issues that have developed because of the endometriosis. So, what does treatment actually look like? Well, it's a really comprehensive whole-body approach. We always start with a gentle assessment and lots of education, so you finally understand what's happening in your body. Then we use hands-on manual therapy. Think of it like a very specific, gentle massage to help release all that deep muscle tension.
A huge piece of the puzzle is calming your nervous system down to make it less sensitive to pain. And finally, we help retrain those muscles so they can function in a healthy, pain-free way again.
Really, our goals are all about getting your quality of life back. We want to reduce that muscle guarding, calm down your nervous system, help with any bladder or bowel issues that have popped up, and give you real, practical strategies to make intimacy something that can be enjoyable again. The ultimate goal is to empower you with the tools you need for long-term relief so you are in control, not the pain. I really want you to hear this. Help is available. This is not something you just have to live with for the rest of your life. With the right kind of specialized care, so many people find incredible relief and truly get their lives back. So the next logical question is, where do you find that kind of care? It is so important to work with people who really truly get the complexities of endometriosis, and that is where a clinic like OVA Women's Health comes into the picture. I mean, just look at that number. With over 2,000 successful cases, the team at OVA has an incredible track record of helping people, just like you, find their way out of complex pelvic pain. But what really makes OVA different is their entire approach. It's not just about their deep expertise. It's about their whole-person trauma-informed care. They get the emotional side of living with chronic pain. They use the most advanced evidence-based techniques, but they deliver it all with compassionate care that validates your experience from the second you walk through the door. And this really says it all, doesn't it? This is their core philosophy. This is a place where you are heard, where you are believed, and where you are respected. Your symptoms are real, your pain is real, and you absolutely deserve answers and a path forward. Living with endometriosis can feel so lonely sometimes, but you do not have to do this by yourself. The team at OVA is here to be your guide and your support system, every single step of the way. So if you feel ready to take that next step, you can start on your path to relief today. Just head over to the website you see on the screen. You can learn more there, or go ahead and book an appointment. And hey, if you're not quite ready to book, or you just want to gather a bit more information, there are some amazing free resources. The OVA Instagram and YouTube channels have tons of great videos with practical advice, and their blog is full of really helpful, in-depth articles. I'll just leave you with this question to think about. Just for a second, imagine it. What would your life actually feel like with less pain? What would you do? Who could you be? I want you to know that future is absolutely possible. And it all starts with getting the right help. Thank you so much for your time.